The question about the usage of hormones and being a causative agent for the development of breast cancer is certainly a very hot topic, and the traditional forms of hormone replacement, as have been shown by lots of studies, and when I say traditional, I'm talking about the pharmaceutical brands of hormone therapy, such as the horse urine pills and the other conjugated estrogens, certainly have been shown to increase the chances of the development of breast cancer if they're coupled with a synthetic type of progesterone. There was a 20-year study done in Europe, and it was published by Dr. Devalar, and he published it in a well-reputed European journal in which he studied 261 women for 20 years. Now you may say, well, 261 women, but that's 261 women studied for 20 years. When you and compared them to a group of women who in essence took no hormone whatsoever. And what he found was that there was no increased incidence of breast cancer in the treated group versus the untreated group, but there were less heart attacks and strokes, there were less problems with colon cancer, there was an expanded lifespan compared to the non-hormone treated group. So therefore, he showed that basically pellet hormone therapy does not increase the incidence of breast cancer. I did a 10-year study on my own patients. I had 976 studied for 10 years. And I should have had close to 20 breast cancers at the very minimum in that 10-year period because of the age group of the patients. And I had one, and she developed it in the first 6 months of therapy. It takes 6 years to show up on your mammogram, so she had it for years ahead, and before she came to us, she was on conjugated estrogen, horse estrogen, before she came and transformed over to pellet therapy. So we help as far as being able to treat her, because we treat breast cancer survivors, but we may not use estrogen, we use testosterone. And testosterone, in a study done at the University of Georgia Medical College by Dr. Natrajan and Gambrell, has been shown to reduce the incidence of recurrence of breast cancer because, as I have said in the past, testosterone reduces the inflammation that produces cystic disease and nodular disease of the breast. So therefore, if you use testosterone in a breast cancer survivor, it will help reduce that inflammatory response that could potentially cause a recurrence of breast cancer. So therefore, utilization of testosterone in breast cancer survivors is perfectly feasible, and we do this quite frequently, and we don't have those kind of recurrences in our patients who use testosterone.